name is Laura Evans, and I'm going to be doing trach suctioning and trach care. Knock, knock, knock. Hello, miss. Hello, how are you? Hand hygiene. My name is Laura. I'm going to be your nurse. Let me check your ID. Alright, perfect. We're going to be doing trach suctioning and trach care on you today. How are you doing for pain? Your pain is under control? Alright, great. Let me check the doctor's orders. Alright. I want you to know that if you feel like you can't breathe, we can stop. So just squeeze my arm or give me a sign. Now I'm going to make sure the bed is in the right position. Patient's sitting in semi-Fowler's position. Put the arm down. And I'm going to put this waterproof thing on. Alright, now I'm going to have my assistant turn on the suctioning to 100 to 120. Oops, that's got to stay on. Then I'm going to put a glove on to assess that the suctioning is working. Yep, it's working. Take my gloves off, do hand hygiene, and I'm going to get my ventilator bag up here ready for me to use. And now I'm ready to open my suctioning kit. So now this is my sterile field. I take out the little container that's going to hold my saline solution. Take my saline solution, check the date. It's good. I add some solution in here. Recap it, date and time. This is only good for 24 hours. Then I will put my face shield on. I'm not going to wear it for the video, but I will put that on. And now I will put on my gloves, which are over here. And I would be using the sterile technique, but I forgot to put them back in my package. So I put these on, they're sterile. I use sterile technique. Alright, now for this procedure, my right hand is going to be sterile, my left hand, non-dominant hand, is going to be clean. Before I get started, I'm going to hyperventilate. Oh, no. It's too obvious. I'm going to connect my tubes, my suctioning with my catheter. Shit. I should have wrapped it. I should have wrapped this around my hand, but I didn't. So anyway, now I've got it under control. Then I'm gonna check suctioning and moisten the catheter. Alright, we're good to go now. So now I'm gonna remove the oxygen with my clean hand. And I'm going to hyperventilate 3 to 6 times. At a normal breathing pace. Alright. Then I put in the catheter about 4 to 6 inches. Once I get into the predetermined length, I turn on I start occluding intermittently and twisting while I take it out. And I only do this for 10 to 15 seconds. Now I'm going to hyperventilate my patient again. 3 to 6 times. Come on. And put the oxygen back on. Alright, then I'm going to rinse out my catheter. And then I'm going to, I would assess the patient and ask him if he was done, if he needed any more suctioning. If he did need more suctioning, I would let him rest for 30 seconds to a minute, and I can only do it 2 more times after this first time that I did it. Since he doesn't want any more suctioning, would you like me to clean out your oral cavity? No. Okay. Well, now that we're done with the catheter, I will take my gloves off with the catheter inside and throw it away. Would you like any, and I would do hand hygiene. Would you like any, would you like me to do any oral hygiene at all? No, you're good? Alright. Then, before I move on to the cleaning, I would assess his respiratory status. It's good. So now we can move on to the cleaning of the trach. I would assess again his pain, and I would tell him that we will stop if he's uncomfortable. So I'm going to remove this old dressing. I would do hand hygiene first and put on gloves. Can't believe I was going to touch him without putting on gloves. Alright, now that I have my gloves on, I can take off the old dressing. Gently try to take it off. I would assess any drainage, throw it away. Then I can take my gloves off, do hand hygiene, and now we're ready to open my kit and start cleaning. So now this is a sterile field. I would check the date on my saline solution, pour it into my container. Then I would time and date it. It's good for 24 hours. Then I'm going to put on my sterile gloves. Didn't go on very good. Alright, now that my sterile gloves are on, I'm going to clean the stoma, moving closest to the stoma outward. So I get my Q-tip wet, and I go closest to the stoma, throw it away, and then I move a little bit more outward, throw it away. Then I do underneath, closest to the stoma, and then again, different Q-tip, a little more outward. Now I'm ready to pat the area dry. And then I'm ready to put on the new dressing. And I do this as gently as possible. How does that feel, Mr. Anderson? Feels good? Alright. Perfect. Then I would re-put on the oxygen. And now I can, then I would reassess his respiratory status. I would take my gloves off, do hand hygiene, and document that I changed his trach dressing. That's it.